Kindly don't evaluate me, please, because I'm doing it for presentation's sake, because this is a uh, little very specific and specialized paper. That's what I'm presenting. Kindly, don't evaluate me. Is the histopathology, immunohistochemistry, and molecular biology in UV-site and enucleated specimen of end-stage ocular inflammatory disease. I'm a pathologist. To describe the histopathology, immunohistochemistry, and molecular biology in various end-stage ocular inflammatory pathology. We had in 10-year period 18 such rare cases where we need to have, unfortunately, eviscerate or enucleate the globes secondary to the intraocular inflammation. Can this specimen be used? That was the question we tried to answer. And we did the histopathology, immunohistochemistry, and PCR study of the paraffin section of such cases. I'll discuss this scenario. We got the fortunately to have a case of VKH and 9 cases of sympathetic ophthalmia. VKH, interestingly, we found CD20, that is a B cell positivity, in addition to the CD3 T cell positivity, which is rare. Sympathetic ophthalmia, as usual, we showed granulomatous inflammation with predominant CD3 positivity. And this is a B cell positivity in a case of sympathetic of VKH, and you can see that the B cell positivity, and this is the lymphocytic infiltration. And this is a case of inflammation in the ciliary body, as well as the choroid is the granuloma formation, and this brown color is the CD3 positivity, T cell positivity was seen. In tubercular panniculitis, we have got 3 cases where Mycobacterium tuberculosis DNA was found to the positive station, but you can see that caseation necrosis over here, which is very characteristic, and the PCR was positive for MPB64 and IS6110 region. In case of Eales disease, we are fortunate to have 2 eyes of Eales disease. It's not usually enucleated, become the chronic non-granulomatous inflammation and blood vessels of the retina. One of the patients who was blind, I almost begged the patient to unravel the mystery of Eales disease. And really, it was fascinating to find out the PCR, Mycobacterium tuberculosis DNA in the enucleated tissue specimen and show the inflammatory cellular infiltrate. And this is a case which has got other eye features suggestive of Eales disease, but histopathology showed vascular channels surrounded by lymphocytic infiltration. And this lymphocyte is interestingly was CD8 T suppressor cells positive and CD3 positivity. And in a case of pars planitis, which you don't remove the eye, you could see the acellular tissue corresponding to the pars plana snow banking areas with chronic granulomatous inflammation. And we could find out the glial fibrillary acidic protein seen that this is a glial tissue. And it was positive for CD68, that is a macrophage marker, CD3 T cell marker, and CD8 T suppressor cell marker. In acute retinal necrosis, very interesting is case, and where you could see the peripheral retinal necrosis and inflammation, and there is an occlusion of the blood vessels were seen, and there is a T cell infiltration, and we could find out the inclusion bodies also, and PCR was positive for paraffin section, HZV DNA was nested, and real-time PCR. And this is a case of a unfortunate case of a scleritis, which was treated with the wrongly by me with the steroid and immunosuppressive agents. We didn't know that this is a TB. It masqueraded as a like of non-infectious uveitis. IVMP was given. Patient lost follow-up. When he came, there was a perforation, and the painful blind eye was removed. And this showed granulomatous inflammation. I was surprised with the giant cell formation, and PCR showed Mycobacterium tuberculosis DNA. And this is a case of tubercular sclerouveitis, which is reported as a kind of a thought to be a tumor, but there is no tumor. There is a granulomatous inflammation, RP cells, IAB bacilli are seen, PCR is positive for Mycobacterium tuberculosis DNA. In conclusion, we are still lacking the knowledge regarding various ocular inflammatory disease is still evolving, and histopathology, immunohistochemistry, and molecular biologic study of this end-stage disease can throw light into the pathogenesis and maybe, who knows, help in the treatment of the future. Thank you very much. Please don't mark.